Today our topic is myocardial infraction. Type of myocardial infraction, risk factor etiology, symptoms, pathogenesis, complications of MI, diagnosis, treatment, medication. Myocardial infraction. A myocardial infraction, commonly known as heart attack, occurs when blood flow decreases or stops in the coronary artery of the heart, causing damage of the heart muscle. A myocardial infraction occurs when an atherosclerotic plug slowly builds up in the inner lining of a coronary artery and then suddenly ruptures, causing catastrophic thrombus formation, totally occluding the artery and preventing blood flow downstream. Types of myocardial infarction. Type 1, plug rupture with thrombus. Type 2, vasospasm or endothelial dysfunctions. Type 3, fixed atherosclerosis and supply-demand imbalance. Type 4, supply-demand imbalance. Based on pathology, two types of myocardial infarctions are transmural infarction. The infarct extends through whole thickness of the heart muscle and are usually as a result of complete occlusion of area's blood supply. Submendicardial infarction involve a small area in submendicardial wall of left ventricle and ventricle muscle. Risk factor etiology modifiable: high blood lipid level, smoking, alcoholism, hypertension, diabetes mellitus, physical inactivity, obesity, emotional stress, lack of estrogen in women, C-reactive protein. Non-modifiable: family history, age, gender, autoimmune disease. Pathogenesis: due to coronary atherosclerosis, coronary vasospasm, coronary thrombosis or embolism, decreased blood flow with shock or hemorrhage, leads to reduced myocardial blood supply. Said myocardial O2 demand. If long-term myocardial ischemia, plug rupture and thrombogenesis, permanent thrombosis, myocardial cell necrosis. Symptoms: chest pain, chest tightness, pressure, squeezing, shortness of breath, nausea, vomiting, sweating, fast heart rate, extreme fatigue, weakness, abdominal disorders, fever, confusion, loss of consciousness, sudden death. Complication: dysrhythmia, heart failure, pulmonary edema, angina, cardiogenic shock. Diagnosis: medical history, physical examination, cardiac stress test, ECG, CT scan, angiography, MRI, blood test. Treatment: first line treatment, oxygen therapy, nitroglycerin, aspirin, analgesia, morphine. Medication: beta blockers, ACE inhibitors, antiplatelet drugs, statin therapy.